guys, we're going to do a port access video today. A few supplies that you have right here are your purple Sani cloth wipes to clean your workstation with. Make sure exposure time is 3 minutes on this. You have your Centralon dressing change kit. This is the kit you will need for a dressing change and doing a port access. This is what has your dressing in it. A couple of extra things for you. You have the Algadex for that would go in between the skin and the actual Sharps device, and then your Sharps devices. This one guy right here, you can see he does not have purple on him. He is plain. He is for a standard port. And then you've got this fella. Power port, purple for power. Always remember that. Power ports need to be accessed with a power Huber needle in case your kiddos need to have contrast. Remember, that is a power injectable fluid. So with that, we'll go ahead and get started and clean our surface. We are going to do a dressing removal and de-access Zoe's port as well. Then we will get sterile and do her dressing change. Not dressing change, her port access. We'll re-access her. Remember, 3 minutes on this right here to get a good kill time. All right, guys, so I did a glove change, and we're going to come over here for Zoe's dressing removal. You have a couple of different things that come on your kit. This detach-all, this is an adhesive remover, as you can see this. This is what you will use on the skin between the dressing and her skin, because as you guys know, the kiddos that have to be accessed and reaccessed and take these dressings off, their skin just gets brutal and just destroyed. So when you go to do this, you're going to pop this, and then you'll start to work around the edges, and that will work this dressing up. So as you go to peel, this will just come right off, and it's quite easy that this peels off. It does leave a little bit of residue behind, or like an oily type residue, but we will do a skin prep on her, and that will take all that off.
I'm just really worried about getting the dressing off at this point. Get it right down to where the Huber needle's still intact, and you're going to pull all that up at one time.
Mm-hmm. Okay, now what I'm going to do is I'm going to grab the wings on this. Just kind of peel that back. Okay, now this is kind of attached down here, but don't worry about it. What we're going to do is we're going to hold her skin and kind of press against the power port and press this up. As you're de-accessing, you can take this piece right here and pull that right over top of the Sharps, removing the safety concern of somebody getting a Sharps injury. Okay, now what we're going to do is we're going to clean Zoe. So you can see Zoe already has her mask and her hairnet on for this surgical procedure. So I'm going to go ahead and open up our supplies. And remember, guys, she's got a power port, so we are going to access her with this power Huber needle. All right, guys, I'm going to open this up, and right here, right in front, you've got a couple of things. More hair nets. Anybody that's within 3 feet of the patient needs to have a hair net and a mask on covering their face. So mom, dad gets a hair net and a mask. I'm going to go ahead and put my mask on. Now, remember, when you're opening up a sterile package, the outer inch of that wrapper, or ½ inch, is not sterile. So that's what we're going to do right here. Only grabbing the edges, and you're going to straighten that out real good. pull that back. Any of those edges try to pop up on you, just try to lay those down really good. So if you can kind of take a look here, you can see the dressing is on the bottom. You have 2 saline syringes. You have your skin prep, which will be in the middle, your microclave right next to the skin prep, and then underneath the skin prep, you'll see the, it's a bandage skin prep, that blue and black. That's what we're going to use under the dressing on her skin right before we put that dressing on. So we already got the microclave. Now we need our purple Huber needle. I wish they were purple. That would be cool. Remember, opening sterilely and plop that onto your field. Make sure that this package does not get close to your sterile field. Also, here's your Algadex. Same thing here. Sometimes these like to stick to the package. Now this guy right here is a small one, you can see. This is what we would call an extra small. This is really all I had available for me to do this video. However, you would want one like the next size bigger than that really, guys. But this is training, so we'll use what we've got. All right, I'm gonna, off on a separate area, I'm gonna go ahead and open up my gloves. Some of us can use the gloves that come on the pack. Others of us, you know how we are, we like to open up our own gloves. So I'm gonna do that. Get gloved up. I'm going to bring this little sterile work area kind of closer to Zoe. We're going to free everything up, get everything connected. Some of this stuff you can just discard off to the side. Surgical nurses, you will, you'll remember on our standard ports, the Huber needle that comes on that pack from the manufacturer does not have these safety wings on it. So you'll know that you have to open up a Huber needle, just the standard Huber needle like we were just showing you a minute ago, on all of those cases. Of course, the power ports, you know, if the surgeon wants them, we can use that, but any of those standard ports, we have to open up a separate Huber needle. You have to discard that. This is your microclave. You'll want to attach your microclave to the distal end right here. Of course, this end is what you'll be using to access the port. I like to pull the clamp down here towards the bottom. And then right here, we will flush. Because we want to be able to access her port, and we're going to pull back a little bit. And we want her to give us blood return on that. This guy, this is what I was talking about. This is a SurePrep protective wipe. Before you put the prep or the dressing onto the patient's chest, you want to go in just a square motion around the border where the dressing would go. I am going to go ahead and open that up. And this up. Put that back there. Let's get our stuff. Okay. Yes. So, go ahead and get all of our goodies. All right. So I'm going to go ahead and prep her chest. We're going to prime the skin prep, and we are going to rub this really good. Remember, guys, ChloraPrep is activated off of friction, so you really want to clean right there at the insertion site. And then clean around. You want to make sure her skin is getting cleaned for a solid 30 seconds. So right there. All right, good. We are good on our skin prep. So now I'm grabbing the device that we'll actually use to access her. So I like to get this nice and in my hand so my 2 fingers can grab right here at the top of that access needle. We're going to pull that little sheath off. Now, I don't know how many of you have seen or felt of a power port before. The power port itself will have these 3 little dots kind of going into like an imaginary triangle. That's how you know and how you can educate your parents to know what their child has. If they don't fill those little dots or those little knobby doos, then their child has a standard port. All right, we're going to go right in the middle of those 3 dots. So 1, 2, and 3, pokey doo, right in the middle. All right, I'm going to hold that in place. We're going to pull back. And in a perfect world, Zoe's port is going to give us some bright red blood right into that tube there. And then we're going to flush that through. And perfect, it's flushing. Now, some troubleshooting points. What if it doesn't pull back blood? I'm going to have Zoe turn her head away from where her insertion site is. And then I'm going to pull back again and see if I get any blood. And then maybe I don't. But if I don't, I'm going to even maybe back that out just a skosh. And try again. And looky there, we're getting blood return. So you know we've done the right thing there. This right here is your Algadex. Algadex is sunny side up. And remember, this little silver piece, that's that silver AG that gets, it's like an antibacterial piece. We are going to come right up underneath that Huber needle and protect the skin, protect that insertion site. So wings down, and now it's time for your dressing. Before we do our dressing, we're going to do this right here, right around the border. I'm going to make this go a little bit midline there. Perfect. Now, here's our dressing. That little split there, you want that to go right down, right where the tubing is. Try and make that look as good as possible for the patient. All right, now let's take off the adhesive maybe. There we go. Okay, now you got a couple other pieces left. This piece right here. You'll lift up the tubing and this will kind of go right up against it. And then you have the piece down here. It's just a small strip for you to put your date, time, and initials so everybody in the inpatient world knows when this port was accessed. Date, time, initials, all the good things. Remember when you are accessing a port, if you are not going to put fluids through it, or if you are, or if the patient is going to have more than, I would say, an hour or two without anything going through it, you will access, or you will HEPLOC this with 10 units per. If this port is being de-accessed and we're sending the patient home, she's going to have an unknown period of time where this port is not going to be accessed, you would use 100 units per protocol. Any questions on this, please use your policy and or refer to your educator, or even hematology oncology clinic. They're very helpful. Thanks, guys.